Hello, and welcome to this presentation on serious mental illness that is on the rise in long-term care populations. I am Abhilash Desai. I'm a geriatric psychiatrist in Boise, Idaho. Serious mental illness such as schizophrenia, bipolar disorder, post-traumatic stress disorder, recurrent major depression, serious addiction problems and personality disorders are rising not only in the general community, where the increase is 39% over the last several years, but in the assisted living facility, the increase is 54%, and in the nursing homes, 77%. This is from researchers at Brown University School of Public Health, Dr. Hua and his colleagues, and they published this research in a very reputable journal, American Journal of Geriatric Psychiatry, just a few weeks ago. This has very serious implications for the provision of mental health services in long-term care. The prevalence of chronic mental illness also varies from state to state. For example, in Wyoming, it's 3.2% in long-term care, whereas in New York State, it is almost 1/3 of the population. Many factors influence this, especially Medicaid funding. People with severe and persistent mental illness have a lot of comorbid medical issues, especially obesity, COPD, diabetes, and they are more likely to have at least 6 chronic conditions, making their management very complex. Diagnosis and treatment needs to recognize that wrong diagnoses, especially in long-term care, are common. Many of them who have labels of schizophrenia do not have schizophrenia, for example. If they do have true chronic mental illness, then the management is very complex because they might require complex psychopharmacology. There is a lot of drug-drug interaction risk, drug-disease interaction risk, collaboration between psychiatry team, primary care team, the pharmacists, and the staff on the ground in long-term care facilities, such as assisted living facilities and nursing homes, is absolutely essential if we are to do no harm and if we are to do good in terms of improving their quality of life as well as their quantity of life. And I'm a strong proponent of collaborative psychiatric care, where I work very closely with primary care team in making decisions regarding medications and especially reducing and discontinuing many unnecessary psychiatric medicines. The resource book that I would recommend is written by my mentor, Dr. George Grossberg, who's a nationally and internationally renowned geriatric psychiatrist, and myself, Psychiatric Consultation in Long-Term Care, a guide for healthcare professionals, was published by Cambridge University Press in 2017. The first chapter talks about the need for high quality, comprehensive mental health services in long-term care. And with this new research, such services are even more important. And then we have chapter 6 on psychotic disorders and violence, where we talk in detail about evidence-based treatment of schizophrenia, bipolar disorder, and other complex psychiatric disorders in long-term care population. Hope this has been useful. Namaste.